Welcome to the ACMG Knowledge Nugget on newborn screening for hemoglobin SC disease. This activity is intended for educational purposes only. Neither I nor the planning committee have any disclosures. This session is approved for 0.25 CME. To obtain CMEs for this activity, you will need to pass the quiz with a score of at least 80% and complete the evaluation. This session is a companion to the Hemoglobin SC Disease Act Sheet, which is freely available at www.acmg.net/ACT. Act sheets are intended to be immediate resources for providers who encounter positive newborn screening results. Please keep in mind that a newborn screening result is just the first step in the diagnostic process. Further testing and evaluations are needed to determine if the newborn has the disease, a true positive result, or is unaffected, a false positive result. The ACT sheets are intended to provide an overview of the diseases identified by newborn screening and clear next steps for the management of a positive newborn screening result. This session will cover background information on hemoglobin SC disease, including clinical features and the underlying genetic cause, actions a primary care provider needs to take upon receiving a screen-positive test result for hemoglobin SC disease, clinical considerations, and supplemental resources. Hemoglobin SC disease is a genetic condition caused by pathogenic variants found in the beta hemoglobin or HBB gene. This gene is responsible for making hemoglobin molecules, which in normal adult hemoglobin, or hemoglobin A, are composed of 2 alpha globin chains and 2 beta globin chains. In hemoglobin SC disease, there are 2 different changes, one on each beta globin chain. These changed hemoglobins are known as hemoglobin S and hemoglobin C. These variants cause changes to the shape of hemoglobin from the normal donut-shaped red blood cells into a sickle or crescent shape. This sickle shape increases the chances of the cells getting stuck and blocking blood flow. This also can cause premature breakdown of the red blood cells. Hemoglobin SC disease can occur in all races and ethnicities. Infants born with hemoglobin SC are typically asymptomatic at birth, with signs and symptoms appearing as beta globin chains begin to develop in the first years of life. Signs and symptoms of hemoglobin SC are highly variable, ranging from asymptomatic to frequent infections and hospitalizations. This disorder, however, is typically milder than hemoglobin SS or sickle cell disease. Characteristic signs of hemoglobin SC disease are anemia or low red blood cell counts, episodes of severe pain, also known as pain crises, and frequent infections. Anemia can cause fatigue, shortness of breath, delayed growth, and jaundice, or yellowing of the skin and eyes. Stroke, organ failure, and pulmonary hypertension can also occur. Without proper treatment, additional problems, including splenic sequestration, retinopathy, pneumonia, acute chest syndrome, swelling of the finger and toes, known as dactylitis, and osteonecrosis can occur. Hemoglobin SC disease is inherited in an autosomal recessive manner, meaning that only infants with a pathogenic variant in both of their HBB genes will be affected. Parents with a child with hemoglobin SC disease are carriers, and in most cases are usually unaffected, but have a 25% recurrence risk with any future children they have together. All states in the United States provide newborn screening for hemoglobin SC disease. A good resource for checking a state's newborn screening panel is the newbornscreening.hrsa.gov website. Screening for hemoglobin SC is performed by examining different levels of hemoglobin molecules. Babies with hemoglobin SC typically have hemoglobin F or fetal hemoglobin S, and hemoglobin C, with no presence of adult hemoglobin A. Now that you have an understanding of what hemoglobin SC disease is, let's talk about what to do if you have a patient screened positive for hemoglobin SC during newborn screening. You will need to take the following actions. First, contact the family and do the following. Inform them of the newborn screening result and that more testing is needed to determine if their child does or does not have hemoglobin SC. Ascertain clinical status, keeping in mind that most newborns will be asymptomatic. Evaluate for splenomegaly and send a CBC. Administer prophylactic penicillin. Provide the family with basic information about hemoglobin SC disease. Second, take a family history. Because hemoglobin SC is inherited in an autosomal recessive manner, it is common for there to be no known family history of hemoglobin SC disease. Third, arrange for a referral to a hemoglobin SC specialist within 12 weeks for a comprehensive clinical evaluation, discussion of the treatment plan, and genetic counseling. The specialist is typically a pediatric hematologist. The clinical evaluation should include a comprehensive physical assessment by an experienced hemoglobin SC specialist. Fourth, working with the appropriate specialist, take steps to ensure confirmation of the newborn screening result. Confirmatory testing includes isoelectric focusing, high performance liquid chromatography, or capillary zone electrophoresis. Fifth, report the final diagnostic outcome back to your state newborn screening program. The goal of treatment for hemoglobin SC is to prevent the health complications that are caused by this condition. Comprehensive care is important to prevent the life-threatening complications of hemoglobin SC disease. This includes modified immunization schedules due to the increased risk of infection in those with hemoglobin SC disease, prophylactic antibiotics to prevent frequent infections, therapeutic medication such as analgesics, and prompt recognition and treatment of vaso-occlusive events. Urgent evaluations of fevers greater than or equal to 38.5 degrees Celsius or 101 degrees Fahrenheit and early screening for organ damage are also important. As you continue to care for your patient with a positive newborn screen for hemoglobin SC, it is likely additional questions and concerns will come up. Here are some resources where you can obtain information on hemoglobin SC, appropriate laboratories and tests, and genetic specialists. Before we end today's session, let's have a quick review. First, hemoglobin SC disease is a serious condition, and identification of affected individuals is essential for the administration of early preventative measures. Second, newborn screening helps with early identification of those with hemoglobin SC. As most newborns will be asymptomatic, it will not have signs or symptoms until they are very sick. Third, ACT sheets are freely available on the ACMG website to review in the event of a screen positive result. In addition to hemoglobin SC, ACT sheets are available for many other conditions that can be identified through newborn screening.